And what happens is that especially those parents who put a bottle in their children's mouths and let them fall asleep with the milk or juice or all those kind of things without at least wiping.
It was schnapps in Austria.
Oh, okay.
It was
Okay.
heavy liquor in Austria. You should tell your patients.
Yeah. So these parents though, they don't know any better. And what happens, you get this baby rot, baby teeth rot, or baby bottle decay as they call it. And it can be a nightmare.
Back with Dr. Johnson from Riverside, a dentist who does anesthesia for people who otherwise would have a very hard time or even impossible to perform dental work. Dr. Johnson, from what age on is it important, since you see children 90 some percent in your practice, for the parents to know that it's time to go with the child to a dentist? Because as far as I know, I may be wrong. I may be wrong, but I never went to a dentist when I was
Hmm.
up till about 4, 5, 6. I don't know,
Hmm.
something like
Hmm.
that.
Hmm.
So shade some light on there, when and why that dental work for children is important.
Good questions. So I think we are not unlike a lot of people who typically go at a later age, and they only go most of the times when there's a problem, right? They don't go any other time, which is always not a good idea, because you don't see a problem doesn't mean there isn't a problem. So from the time a child gets their first set of teeth, which are usually the teeth in the front, top and bottom, they should be going to see a dentist. And that visit typically is usually no more than maybe, I don't know, 15, 20 minutes, because they walk in, the child has to become comfortable, and the pediatric dentist or general dentist just takes a look, make sure everything is fine, gives some education to the parents at that point, um, helping them to understand what it is they need to do to keep taking care of the teeth to prevent decay, and setting them on a schedule where the child comes into the office more often, getting accustomed to coming into the dental office and reducing some of that fear and anxiety. So, from the time you have your first set of teeth, you should try to make an appointment to see your pediatric dentist or a general dentist who sees children.
Okay. What problems specifically do you see happening, could potentially happening, probably don't have to happen, thanks God, but which problems would you be seeing as you kind of like watch the growing of this teeth and babies, you know?
Absolutely. Uh, okay, so sometimes what you'll notice is that not all parents are very knowledgeable about oral hygiene for their children. They're not very knowledgeable, and that's not necessarily their fault. It's just something that probably people don't think too much about. And what happens is that especially those parents who put a bottle in their children's mouths and let them fall asleep with the milk or juice or all those kind of things without at least wiping.
It was schnapps in Austria.
Oh, okay.
It was
Okay.
heavy liquor in Austria. You should tell your patients.
Yeah. So these parents though, they don't know any better. And what happens, you get this baby rot, baby teeth rot, or baby bottle decay as they call it. And it can be a nightmare. So those are things you're watching for. And the visit is just as much for the child as it is for the parent, right? So that you continue to update them, explain how certain things work to them, and they can get into a habit of bringing their child in for regular visits. So that's the type of thing I will start to see, decay of those teeth in the front as the child gets older, and they start to get their primary molars in the back, where that those teeth have a lot of crevices in them. You'll find that, you can get a lot of decay in there as well, abscesses, all those things you have to be looking out for.
I see. Is it also a potential that you will notice while you watch this teeth growing that you then can prevent, for instance, needing to wear ortho appliances when the kid becomes 14, 16,
Yes,
or
yes.
at least
Yes,
less, instead of 4 years or 2 years, maybe only a
you
couple
are,
months?
yes, you're on track, Helmut. That's an excellent point you brought up. So you are able then to follow to make sure that the eruption, what we call the eruption schedule, or in other words, the time that the teeth are supposed to actually erupt or come into the mouth, you're making sure that they're all coming in on time within the time they're supposed to, coming into the right place, not coming in crooked or all those kind of things. So you're able to see that from early and make any recommendations for adjustments early on. All of those are important. For most people, things come in and fall into line nicely. Many others, they don't. Case in point, if a child loses a tooth prematurely, it messes up a lot of things when it comes to spacing and those types of things. So you really, really need to get that looked at so that you can have your dental professional advise you on those things.
So, are you saying that if a child loses a tooth prematurely, and which sometimes most of us probably wouldn't know? I mean, we did not go 8 years to dental school
Sure.
to know what's premature loss and whatnot. A small
Right.
kid loses a tooth, that's like the tooth fairy comes. What's the big
Right.
deal?
Right.
And so, since we don't know, we kind of should go because what happens? The next tooth might then, because of it, just find its own way a little bit weird, like a loose river, like it just doesn't know where to go, and
Yeah, exactly, right there. The primary teeth are there for several different reasons. We can talk about that another time. But one of those things is to make sure that they're keeping space for when the permanent teeth are developing beneath them, right? So if you knock a tooth out by mistake, comes out early, or you had to extract it because it was decayed and had an abscess, many of the dentists will put what they call a space maintainer in the area so that it doesn't close and prevent the other tooth from not erupting as it should. So there are various reasons why you want to make sure that if you lose a tooth prematurely, that you visit your dentist to make sure they can tell you and advise you as to what it is you need to do.
all right. Last question, fast. Most of us are fearing to have, not in my age anymore, but to have an impacted wisdom tooth. Is that
Yes.
perhaps something which develops already at a very, very young age, or not really?
Not necessarily. Impacted wisdom teeth are impacted for several different reasons, and is not always associated with losing a tooth early or any of those kind of things. Sometimes people just don't have enough space in their mouths for those teeth to erupt normally, and as a result, they remain impacted. And then not every impacted wisdom tooth needs to come out anyway, but then that's a talk for another time. But
Yeah.
yes. Mhm.
Yeah. Well, thank you very much.
You're welcome.
You did bring some enlightenment to us here. Thank you very much.
You're welcome.